You're listening to the Mother to Baby podcast, medications and more during pregnancy and breastfeeding. Ask the experts with your host, genetic counselor and mom of three, Chris Stallman.
Welcome to our Mother to Baby podcast. My name is Chris Stallman. I am a genetic counselor. I'm a mom of four now. If you tuned in last time, you know that we just delivered baby number 4, and still a teratogen information specialist with Mother to Baby. So in case that's new to you, or just as a refresher, teratogen information specialist just means that I give information to women and their healthcare providers about exposures during pregnancy and breastfeeding, also before they get pregnant, or if people have questions about adoptions. And exposures can be anything. So it could be a medication that you're taking. It could be a chemical that they're using at your workplace. It could be nail polish or anything in between. And Mother to Baby is a nonprofit organization that answers questions about any exposures during pregnancy or breastfeeding. On today's episode, we are continuing our theme of Heart Month, with it being February. And we have returning Dr. Gina Lundberg, who is the clinical director of Emory's Women's Heart Center. She is also the associate professor of medicine at Emory University School of Medicine. She also treats patients with high cholesterol and heart disease, pregnant and non-pregnant people as well. She has a lot of really good information, a lot of wonderful experience. We had Dr. Lundberg on the episode, and we are very grateful to welcome her back. How are you today, Dr. Lundberg?
Oh, I'm great. And thank you so much, Chris, for your warm welcome.
Oh, my pleasure. So February being Heart Month is very exciting. Is there anything special that goes on during Heart Month?
Probably the most important thing that goes on is our awareness campaign. The American Heart Association, the American College of Cardiologists, multiple organizations across the country are promoting Heart Month with wearing red, with heart-healthy menus, heart-healthy diet information, exercise, really just getting the word out that heart disease is highly preventable with a good, healthy lifestyle and routine medical care, and getting people to know that. It's strange, but women think the number one killer of women is breast cancer. Sometimes they think it's ovarian cancer, but it's not. Unfortunately, it's heart disease, and nearly 2 out of 3 women, or 400,000 women a year, die from a cardiovascular cause.
Wow, that seems like something that would be good to know, but I know what you mean. I mean, automatically we think as women, oh yeah, things related to conditions more of being a woman, like you said, breast cancer, ovarian cancer, but heart disease sounds like it's pretty prevalent. And I know last time we talked a lot about high cholesterol specifically. Today, what we were hoping that you could do for us is share some tips for the general population. So maybe someone who hasn't had one of these serious conditions now, but what kind of tips do we have to get our hearts healthy, both as women, but also people who may become pregnant or start breastfeeding?
Well, one of the best things you can do is the simple, old-fashioned, nothing sexy, just have a healthy lifestyle. So by that I mean maintain a good, healthy weight, have a good, nutritious diet, have routine activity and exercise, a good night's sleep, drink plenty of water, and try to reduce your stress. And while that sounds simple, it's very hard to do. Particularly a busy mother who has little children at home, right?
Sure.
So these healthy lifestyles really are extremely important. It also helps, though, to have routine follow-up with your physicians. And most women of childbearing age are getting their pap smear and being evaluated yearly. And that's when you want to ask your doctor, what was my blood pressure, what was my blood sugar, and what was my blood cholesterol? Because those are the numbers that we say, know your numbers, to also help confirm that you have a healthy lifestyle, but also healthy numbers that won't lead to diabetes later, high blood pressure later, or obviously we want to prevent heart disease.
So you mentioned something really interesting to me. So you mentioned high blood pressure. Of course, I knew about that. High cholesterol, I knew about that, but also blood sugar and then the possible risk for diabetes. So my guess is that sugar levels and eventually diabetes can impact heart health. Is that correct?
Yeah, actually, diabetes is the number one risk factor in women. In fact, diabetes increases a woman's risk of heart disease 4 times, but only a man's risk twice. So it's a very powerful and a very important risk factor in women. And we consider pregnancy a woman's first stress test on her heart. So if a woman's had gestational diabetes, we definitely want to follow up with her, because not only is she at risk of diabetes later in life, she's at risk of heart disease later in life.
Wow, that is particularly good to know. So, a little bit of honesty time here. In my last 2 pregnancies, I was diagnosed with gestational diabetes both times. And the first time it happened, it was brand new, because with my previous 2 pregnancies, I didn't have it. And I will say that my healthcare team, did put a lot of emphasis on making sure that I was tracking and being very well treated. They did an excellent job and everything turned out very well. But it was a really scary thing. And I don't think that I knew that it will increase my risks later in life.
Well, part of that is because in the middle of a pregnancy that's having some complications, the last thing we want to do is worry a woman, freak her out, and scare her. Great, now I have to worry about heart disease for the rest of my life. But current recommendations suggest that when you come back for your postpartum follow-ups, that we encourage you, as I say, get the baby weight off. So try to get back to a pre-pregnancy weight. We do encourage breastfeeding during that time. And we also want you to either go see a primary care doctor like internal medicine or family practice, or a preventive cardiologist, which is what I am. And really, we'd like for you to see them within 6 months of your delivery. And then once you've had a pregnancy with gestational diabetes, you are at higher risk for the next time. And so we want you to see a doctor during that time period. A lot of people have this idea that, if you just ate healthy, you wouldn't get diabetes. But that's not necessarily true. So diabetes is from a metabolic problem where you either have to make more insulin to get the sugar in the cells, or you can't make enough insulin. And so even thin people can get gestational diabetes. People with a very healthy lifestyle can get gestational diabetes. And we like to use it as a warning sign that long term you're going to want to, be very mindful of your exercise, your weight, and your nutrition.
That's so interesting that all of those factors they have multiple benefits. So eating well, exercising is great for your heart, but it's also great for your blood sugar, which is also great for your heart. They're all sort of connected. And I think that too is important to remember. And I do want to say thank you for not trying to scare women unnecessarily. I mean, I know, you have to tell the truth, but like you said, there's a lot of pressure and other things going on in pregnancy. I will say that my team did everything that you mentioned except scare me. So I think they did a really good job.
We don't want to scare you. But having had gestational diabetes, I think now that you have a healthy baby, you should maybe talk to your gynecologist, OBGYN, about who you could see in your area that does good prevention work, and then you're just way ahead of it long term.
That is an excellent suggestion. Thank you for that. Dr. Lundberg, what are some of the risk factors related to heart disease?
So the most common risk factors are: don't smoke. Smoking increases your risk of stroke and heart attack long term. Have a good exercise routine and avoid obesity, which we call a body mass index of over 30. And treat high blood pressure to goal. Unfortunately, as women get older, they have more high blood pressure, and it's more challenging to treat. We know about high cholesterol, and while it's concerning when a woman's young, of childbearing age, all the cholesterol numbers tend to get worse at menopause. So the LDL bad one gets worse, the HDL good one gets lower, the triglycerides, which is also bad, gets higher. So all of these are an unfavorable process that happens after menopause, and is part of why being a postmenopausal female is also a risk factor. We've talked about diabetes, very important risk factor, and then high blood pressure. So what we're learning is that there's some new emerging risk factors. We talked about that pregnancy is the first stress test for the heart, so gestational diabetes, but also the high blood pressure problems during pregnancy, what we call preeclampsia, eclampsia, or pregnancy-induced hypertension. They're also worrisome. We know that the rheumatologic disorders such as lupus and rheumatoid arthritis increase a woman's risk of heart disease. Interestingly, early menopause increases your risk. And then just stress, depression, trauma in a woman's life. These are also very important risk factors. So these are things that if a woman has these in her life, she really wants to discuss them with her doctor long term.
So Dr. Lundberg, at what age would it be considered early menopause?
So we call early menopause before 40. It's very common for a woman to start having what we call premenopausal symptoms as young as 45, 48, where maybe she skips a period here or there, but then she has it again, where she's having some weight gain, particularly around the abdomen. She may be having a lot of trouble sleeping, not just due to hot flashes, but just can't sleep, can't fall asleep, can't stay asleep. But also there can be mood swings and feeling like you can't multitask like you used to, or you can't stay on focus. All of these things are related to menopause, including slowing down of your gut motility, feeling like you're constipated more, feeling more joint pain. All of these things are related to menopause. But true menopause is when a woman has not had a period for 12 consecutive months. And the average age of menopause in the United States is 51. So to go without a period after age 40, at age 40, is considered early menopause.
So if women have any concerns about any of these symptoms that they're having or not having, then they should talk to their healthcare provider, because a conversation can't hurt to have, and it may give them some good information.
Absolutely. And this perimenopausal state can last for years. In fact, I talk to 85-year-old women in my clinic who still have hot flashes. So a lot of people have the idea that menopause is just a short-term thing, but for many women, this goes on for, up to 20 years. So It's more of a state of life than just a transition period. I'm 58, and I keep waiting to quit having hot flashes, and it's not happening.
I just started before my most recent pregnancy. I was having hot flashes for about 6 months, and then I got pregnant and stopped. I was like, oh my gosh. Okay.
Yeah. The joy of being a woman.
Yeah. Oh, yeah. So a large part of what we were talking about, Dr. Lundberg, is the idea of being on top of things and preventing. But, sometimes we end up getting to the treatment phase where we do need to treat somebody for a condition. And as we mentioned, especially in pregnancy and breastfeeding, sometimes there's so little information about what medications can be used. But thankfully, MotherToBaby is currently enrolling pregnant women in a study that looks at the use of certain medications that can treat high cholesterol. And I know that you also are part of some new studies.
Yes, so we are trying to track if any women are on the PCSK9 injections for high cholesterol and they find out they're pregnant. The drug we're tracking is Praluent, but it's going to be very important to know, are these drugs safe in pregnancy, particularly for our women at the highest risk, women who have familial hypercholesterolemia, a genetic disorder.
Excellent. So if anyone is interested in learning more about our studies, or maybe even participating in one of our studies, you can visit our website, MotherToBaby.org. That's MotherToBaby.org. And there is a page that you can go to that will give information about the kind of studies that we're doing and ways to enroll. And even if you don't have one of the conditions that we're studying, we still want to hear from you, because what we do also is enroll women who don't have any medical conditions, because your information is valuable and important as well. So for more information about the studies, whether you have a condition or not, just visit our website. So Dr. Lundberg, once again, thank you so much for your time and your expertise. We really appreciate what you have to offer our listeners. And as a final thought, is there anything else that you would like to leave us with today?
Well, I'd like to leave your listeners with this very encouraging and positive thought that 80% of all cardiovascular disease is preventable, and that with knowing your risk factors, knowing your numbers, and good routine care with your primary care physician, you really can be ahead of this or beat it altogether.
That is really reassuring and definitely good information to have, as February actually is also my birthday month. So I'm turning a little bit older as well. So it's good to know that there are things that I can do to maintain and prevent some of these conditions down the road. So that's all for us today. Thanks everyone for joining us on this episode of our Mother to Baby podcast. We're really glad that you're here listening. We hope that you're going to come back again in the future. If you've missed any of the previous episodes of our podcast, you can find them on our website, so MotherToBaby.org. You can also find them on Spotify or iTunes or however you listen to your podcasts. And remember, we're here to answer questions. If you have any questions about exposures during pregnancy or breastfeeding, and again, exposures can be anything. If you're worried about getting your nails done, if you're worried about a medication or a chemical spray or Zika virus, anything, feel free to give us a call. So remember, we're toll free, 866-626-6847. You can also reach us by text message at 855-999-3525. If you have a question about the show, an idea for the show, or want to be on the show, you can reach us at contactus@mothertobaby.org. And again, you can always visit our website. That's at MotherToBaby.org, MotherToBaby.org. So this is Chris Stallman signing off, hoping that you'll join us again the next time. And remember, Mother to Baby is here for you. Take care.
Mother to Baby is a service of the nonprofit organization of Teratology Information Specialists and supported by the Health Resources and Services Administration of the U.S. Department of Health and Human Services. It's made possible through generous donations from listeners like you. To learn more about Mother to Baby, please visit mothertobaby.org.